Welcome back. Well, apraxia is a neurological condition that results in unclear speech. Here to discuss the most common signs of this and how to diagnose and treat the disorder is speech pathologist Kyle Meades from the Therapy Group of Tucson. Kyle, it's always great to have you on.
Good morning.
You always take a very frank and educated approach to things like this. So let's dive right in. What is apraxia of speech?
Apraxia of speech is a speech problem. When I come on this show, I'm always talking about something related to speech or language, stuttering, voice problems, difficulty swallowing. But apraxia of speech is more like a problem with it's a neurological problem of speech. It's when the brain has difficulty programming the lips, the tongue, the jaw, the respiratory system to produce clear speech. So the person knows what they want to say, but it just doesn't come out the way it's supposed to and the way it's intended.
Okay, so that's sort of the scientific look at apraxia of speech. Now, what are some practical symptoms that people would notice if they see it in themselves or maybe they see it in kids?
You know, we see a lot of kids. Every month we see about 1,600 children, and the biggest sign of apraxia for an infant would be, let's say, the child's not cooing or babbling at a certain age, or there's difficulty with producing certain sounds and sound combinations like consonants and vowels. The child has limited word usage. With older kids, you'll see problems with groping. Groping is when the person obviously knows what they want to say, but they're really trying hard to get that out, and the sounds just won't come out. Again, the person with apraxia knows what they want to say, they have the language base, but when it comes from the brain to the lips, the tongue, the jaw, the mouth, the respiratory system, the phonatory system, the vocal cords, it's kind of mumble jumbled, and kids get frustrated.
I'm sure. I was just going to say, I can't believe how incredibly frustrating it must be to know what you want to say, not be able to get it out there. And you said this mostly affects kids, or can it affect other age groups?
And you know what you want to say, and you try to get it out, and then it comes out backwards. Yeah. So yeah, and it's prevalent. Normally we see this developing in children as early as 18 months of age, 20 months of age, but also too with adults, you see this symptom after a stroke. So someone, their whole life, they've had a wonderful life and they're communicating effectively, and all of a sudden after a stroke you might see that the person, again, they know what they want to say, but when they want to say it, it comes out all backwards and mumble jumbled.
Well, and people have to wonder, you know, with this being so prevalent, like you said, in kids, how can this be treated early enough in their life so that it doesn't affect them going forward?
Well, the best thing to do is get an evaluation. A lot of pediatricians in this town, a lot of doctors, they know what they're doing, and when they see that a child is not developing appropriately for speech and language abilities, they'll send that referral to us. And so when the parents come in, we listen to the parents. They know their kid more than anyone. So what we do is we give them an assessment. Again, there's no one test to determine if a child has speech apraxia, but with a good speech pathologist who's trained in this condition and this disorder, we know what to look for. We do an assessment. We listen to the child's sound development. We look for problems with pitch and prosody, and we look at voice. We look at everything to make sure that we can make a clean, clear diagnosis of apraxia.
Well, it certainly seems like a comprehensive set of tests that you guys do, and you
Absolutely.
really pinpoint it to what the issue is. And people have to wonder, you know, with something that's speech therapy, and they're going to get this kind of help, they're going to think, well, is this really expensive? Is it covered by insurance, et cetera? So what can you tell people to sort of quell some of those fears?
Well, apraxia of speech with insurances, I mean, insurances are tough these days. They don't really like to pay for anything. You know, if it's developmental, you know, if it's just a child who has, you know, late sound development, a lot of insurances won't pay. And if it were covered, you know, the patient might have a $40 copay. I mean, our cash rate's $45.
Yeah.
So it's only $5 more. But a lot of insurances will pay for the treatment of apraxia of speech because it is a medical condition. It's a neurological problem, and a lot of times those insurances will pick this up. But you need to go to the pediatrician and get this diagnosed first.
Yeah, and there's no reason that you shouldn't bring it up to your pediatrician.
Absolutely.
They're gonna, recommend that you get this type of therapy, but it's not just apraxia of speech that you guys really help and hit on, it's a lot of other types of disorders. So can you tell the people at home who may not know a lot about Therapy Tucson?
Absolutely. We not only treat speech problems or language problems, we also work with people who stutter, voice problems, people who have voice problems, hoarse voice, raspy voice, breathy voice, difficulty swallowing. We also have occupational therapy services too. So it's not uncommon for a child who has severe speech problems who also may benefit from occupational therapy services too. And we have many therapists in our building. We're actually expanding our services. We're moving into a 5,000 square foot building here in the next 4 months. So we're really growing and we're doing a great job. It's nice to see the kids get the help that they need.
Absolutely. Well, you guys really are at the forefront of this type of help and this type of therapy, and it's incredible when you come on and tell us about all the different types of things that people really need therapy for that they may not have known exactly what they are.
Yeah, a lot of families, they just, oh, my kid's not talking. He's pointing and grunting and pulling me around the house and pointing to everything, and there's a solution.
There is a solution.
Absolutely.
That's the big message that we're leaving off with today. Kyle, as always, thank you for coming.
Thank you.
Of course. Now, guys, if you need speech or occupational therapy services, call Therapy Group of Tucson at 232-2021. For more details, visit supportvoice.com.